Hi, how are you doing today? So before I go into this case for today, I want to say that if you have any video, any picture, I have some people that are already doing that. They send me a lot of pictures, videos to watch, and then they tell me, advise us, what do you think? What are your thoughts? I'm always here to respond to such videos. So this picture here shows a child's arm and says, my son developed this condition after receiving his vaccination. Should I be worried? So if you look at that arm, that's the left arm of the baby, and there is something that looks like a bump with pus, coming out of it. And so that is what we are going to talk about today. So looking at where the bump is, it is likely BCG vaccine, which is what we use to prevent tuberculosis. And when a child receives BCG vaccine, it is essentially normal to have some form of reaction around the site of the injection, either redness, formation of a bump, or sometimes a little piece of pus can actually come out and then subsequently to form a scar. And that is why in a lot of people, if you look at your arm, you'll see that you have a scar on the left side of your arm, and that is essentially normal. Now, in some cases, in some children, this reaction can be a little bit exaggerated, so it can become bumpy, and then even their lymph nodes, around their armpits, their neck may be enlarged, and this is what we call BCGitis, which also is a normal finding. However, if you notice that the pus is a lot, or the lymph nodes are painful, or they are quite large, then you should actually go to the hospital, see a pediatrician, and let them examine your child to tell you if it is normal or not. And very important, if you receive BCG vaccine for your child and you notice formation of pus around the area, you should get cotton wool. Please, this is very, very important. Get cotton wool, use it to wipe that area, dump it into the toilet, flush it, and wash your hands immediately. But you see this picture, this is essentially normal in a child that has just received BCG. And does this make BCG unsafe? No, 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 not at all. It just shows that your body has taken the vaccine and the reaction is good. It is a good sign for a child that had BCG to have some swelling and all that around that area. It is actually a good and expected sign in children that had BCG vaccine. So if you have any other questions or you have concerns, please reach out to me. I'll be so eager to respond. My name is Ayobola Debowale. I am your baby's doctor.